Gender-affirming care is the process of assisting transgender individuals with medical treatment to physically express their gender identities. Although the transgender community's visibility has grown, healthcare workers' exposure to transgender individuals, particularly transgender males during pregnancy, remain restricted. There is a scarcity of knowledge on best practices and standards of care for transgender males within an obstetric setting. Research has shown a lack of education and discrimination towards transgender males in an obstetric setting can lead to negative health outcomes for the patient as well as the baby, including extended hospital stays, injuries, death, and mental health problems. Incorporating gender-affirming care into a clinical practice has been shown to improve mental health outcomes, including depression, anxiety, and even suicidal ideation among transgender individuals. The overall goal of this evidence-based practice project is to improve healthcare workers' understanding and attitudes towards pregnant transgender individuals. This is to be accomplished by providing staff trainings on gender-affirming care in order to decrease barriers in treatment, particularly in an obstetric setting. The databases primarily used in our research was JBI, PubMed, and JSTOR. Keywords included transgender male, pregnancy, gender-affirming care, and obstetrics. Our proposed intervention included to start with the clinical environment. The first goal is to create a welcoming space for the transgender population. For example, instead of referring the obstetric health clinic as a women's health clinic, language could be modified to refer to the clinic as a sexual and reproductive health clinic. Another example is to use gender-neutral signs for restrooms. Another intervention or area of focus was using clinical staff training during the prenatal stage. The implementation strategy would be used to provide trainings to nurses, physicians, and ultrasound technicians to discuss the key distinctions between sex and gender, using general neutral terminology for patients and fetal exams. The goal of this implementation is to decrease the feelings of gender dysphoria that emerge during physical examinations. The final area of focus for our implementation strategy would include training of the clinical staff and healthcare providers on how to properly provide support and guidance to patients during the lactation feeding period. The training would consist of proper terminology, for example, not referring to the lactation stage as breastfeeding, but instead use the term chest feeding. As stated previously, the goal for that implementation is to provide support and guidance to the transgender population during the lactation stage. By integrating gender-affirming care throughout the pregnancy stages, healthcare staff members can combat these barriers in treatment faced by pregnant transgender men. By incorporating gender-affirming care, this can lead to a decreased feeling of gender dysphoria and encourage transgender individuals to seek healthcare treatment more frequently. The lack of education and discrimination towards transgender men and obstetrics can lead to negative health outcomes for the parent and infant, including extended hospital stays, injuries, death, and mental health problems. According to the review of research and evidence, recommendations include providing annual education for healthcare workers regarding the care of transgender males and the implementation of gender-affirming care.